On July 13th, 2022, the House Energy and Commerce Committee marked up the Lymphedema Treatment Act. These are just a few of the many bipartisan members who spoke in support of the bill.
And finally, we'll consider H.R. 3630. This is the health bill, the Lymphedema Treatment Act. And this important bill will provide Medicare coverage of compression garments for individuals with lymphedema, a chronic condition commonly caused by cancer treatments that remove or damage lymph nodes. While there is no cure, the use of compression garments can significantly improve outcomes and reduce the risk of infections and costly hospitalization. This bill will ensure that Medicare beneficiaries with lymphedema have access to the full range of treatments they need. So I look forward to advancing all 5 of these bipartisan bills today.
This bill is about closing a loophole that is restricting access to full care for the nearly 3 million Medicare beneficiaries suffering from lymphedema. Not having the necessary treatments covered by Medicare is something that impacts a patient's quality of life. And I'm glad to see that we're taking the necessary steps to rectify this incredibly important issue to these individuals. As a physician who has treated patients with lymphedema, working with occupational therapists, physical therapists, other physicians, I can attest firsthand to the necessity of the treatments that will be covered in this bill going forward and urge support for this legislation.
I remember meeting with a sufferer of this, and it has touched all of us. And that's, it's grassroots people coming to Washington to make a difference in their lives. Is what we should respond to and react to, and we are today. And I appreciate that, and I'm committed to moving this bill forward today.
I heard from constituents like Patty from Ware, New Hampshire, who has lymphedema as a result of a previous cancer diagnosis, about the importance of these treatments. I also heard from Linda of Salem, New Hampshire, who's lived with lymphedema since her childhood. At 73 years old, she explained how more expensive treatments like hospitalization, visiting nurses, antibiotics for infection, sequential pumping machines, and the list goes on, are all covered by Medicare, and yet compression, the cornerstone of all lymphedema management, has not been covered.
Mr. Chairman, today we're taking a critical step to provide life-saving care to millions of Americans. Prescription medical compression garments are the long-established standard of care for treating lymphedema, but Medicare is currently unable to provide coverage for these vital supplies due to a lack of benefit category. As a healthcare professional and co-chair Cancer Survivors Caucus, I came to Washington to make a difference and help those who are suffering. This bill takes a critical step to ensuring our most vulnerable patients have access to the care they need. The Lymphedema Treatment Act is one of the most bipartisan bills in Congress by a large margin. As has been noted, it has over 350 co-sponsors in the House and over 70 co-sponsors in the Senate. This is an example of something we can accomplish together in a bipartisan manner.
I am really, really grateful to see the bipartisan support for the Lymphedema Treatment Act that we're going to move today. I want to thank all of the advocates, the stakeholders, and all of the members on both sides of the aisle who have stepped up to do this. You should also know that studies have estimated that Medicare would save about $1.5 billion over 10 years because of the decreased hospitalization and other prevention complications that cost real money. But more importantly, cancer survivors and others, lymphedema sufferers, would be able to finally get the relief that they need. This is really a technical addition that is going to make all the difference in the world to so many people, millions of Americans.
I just wanted to thank Chairwoman Schakowsky for her longstanding advocacy on this issue. I know this isn't just a senior issue, but I know she's been a longtime advocate for senior issues, and over 350 members, bipartisan, signed on in support of this bill. As she mentioned, there are definitely some gaps in coverage, particularly with regard to garments, and we do need legislative authority to cover these items. So this bill is going to ensure that patients with lymphedema have access to the full range of treatments that they need, and I urge its passage.
The Lymphedema Treatment Act was unanimously passed out of committee on July 13th, 2022. Please help us ensure that the Lymphedema Treatment Act becomes law during the 117th Congress.